Hello, I'm Dr. Ruth Roberts, your pet's ally, and I'm glad you could join me this week. I want to talk a little bit about one of your probably most feared subjects, and that's having to take your pet to the emergency clinic. And since I've sold my physical practice and we've been traveling, we've had to take Mona a couple of times. And unfortunately, we had to take her almost a week ago. And thankfully, everything has worked out beautifully. But we had to take Mona a week ago to the emergency clinic in Santa Fe. And I have to say, if you're in Santa Fe traveling, we had as wonderful an experience as is humanly possible. So let me tell you kind of what happened. Mona is infamous, and Debbie, you know this. Mona is infamous for eating things she should not. She has eaten and lived to tell about it. A jar that was pushed off the counter by the cats filled with bacon grease. Not just the bacon grease, also all the glass shards. And this is when we were still in Charleston. I was on vacation. My dear friend Mike Daly was taking care of the pets for us. He came home and cleaned up the mess and then realized Mona was over in the corner going, "Oh," and he looked at her and said, "Oh, you're moaning a lot more than usual." Took her to the emergency clinic in Charleston. Yes, indeed, she had eaten the glass and the bacon grease. And thankfully, my dear colleagues there, Dr. Kristen Welch, was able to fish out all of the shards of glass using an endoscope. Mona has since eaten half a pound of raw bacon and had absolutely no problems other than feeling a little cruddy for a day or two. She has eaten, if we don't watch her, I mean, I swear, we have to get this dog a basket muzzle because she snarks down stuff so fast. It's just incredible. So this last go round, she'd had to go outside in the morning, and we were able to have a door open, so she was able to come back in on her own, not realizing that Pepe had knocked over the trash can, and so she went right over and gobbled up duck bones. And this did not go well. So it took about a day, and she started having just horrible, horrible diarrhea. Got worse the next day, and it was like, okay, working our way through this is not happening. So we went over to the ER. They got her in. We hit it beautifully timing. We were actually the only people in the building, which is stunningly amazing on a Friday night. They got her in, got some fluids started, got some pain medicine going for her, and got some x-rays done, blood work, all of that stuff within about an hour, which was just astonishing. And then, she had so much gas and bloating in her belly that they had to give her an NG tube, so a little tube down her nose into her stomach to relieve some of the air and the pressure there. And then once that air came off, they reshot some x-rays and found that, yep, there were bones still stuck in the stomach itself, and thankfully they were big enough that they could be retrieved endoscopically. The veterinarian on duty there arranged to have us go to another local practice that did have an endoscope. They were able to fish out the bones along with a few other items that we have no idea how she got. These folks were wonderful. So at the private practice at Gruba Veterinary Clinic, thank you very much, Dr. Gonzalez, they were also able to clean up her mouth. She had a loose tooth, so this prevented her from having a second anesthetic procedure. We picked her up that afternoon. She's been on IV fluids the whole time, took her back to the ER so that they could continue the IV fluids overnight because Mona, she would have torn out her intravenous catheter without somebody watching. and we were able to pick her up the next day. She was ravenous and ready to go eating. She did beautifully, and this is an example of how well veterinary medicine can work when you need it. Golly, and did she need it? She was one very sick puppy at 15 and a half. The amazing thing is her kidney values and liver values, everything is still normal, even being so profoundly dehydrated, so that was stunning. But this isn't everybody's experience, and I've had clients when I was in practice, show up at my practice the next day after a long weekend at the ER with a dog that has a blown disc, and they're getting told at the ERs, oh, well, if you can't afford the $5,000 MRI and back surgery, then you just need to euthanize your dog, which is absolutely ludicrous, because before all of these surgeons and stuff were around, we just did conservative management, and basically what that means is reducing inflammation with medication and pain so that that disc can heal if it is possible. And I will tell you that not every dog was able to heal without surgery. But I'll have to say this as well, there are plenty of dogs that have surgery and don't heal either. So I just used to hate that, because I mean, $5,000 is an enormous sum of money, and if you don't have it and you go to the ER and you're given these two options, how good does that make you feel about yourself and what the doctor is offering you as your set of options? I mean, all of us know there's always more than two choices, and maybe the conservative management is not the best, but if it keeps the dog pain-free and happy and healthy and pretty mobile, what's wrong with that, right? Debbie, I know you had experience with Daisy getting surgery, and you guys are still coming back from that and have to kind of watch how she is. And Daisy's another one of our little dachshund friends. So that's kind of, that's kind of my beef. ERs can do marvelous things. And the thing is that in veterinary medicine, we have so many options about how to help our pets. And you have to make the choice with your doctor or with your backup. And in some cases that's me, and in some cases it's another veterinarian that offers a more holistic approach about what is right for you and for your pet. So if you're offered two options and one of them is euthanasia, there generally is another choice out there. And I won't say that's always the case, but the vast majority of time there is another choice. So how do you, the layperson, know when you need to take your pet? This is such a frustrating thing, because none of us want to go. All of us want to delay it until later. And as a veterinarian, I can tell you that there are a lot of folks that did delay until it was too late. And that's when, we've got three options and one of them is euthanasia. And I used to hate that, because how do you look somebody in the face and tell them that your baby is gravely ill, and because we're in this situation and we've prolonged care, there is a good chance that we may not be able to make this better for you and your pet. So that used to just burn me up. So again, we've launched our new paid members area called iPets Ally. And in that area, you'll be able to search through all of my videos. And we're still a work in progress, so pardon our dust as we continue to grow it. But you'll be able to search by specific categories, so kidney disease, cancer, heart disease, that sort of stuff. And on each month, I'll be teaching for about 30 minutes. This month, our inaugural teaching session will be November 21st, and we'll get you some more details on that once you sign up. But what I'll be talking about is what to do in an emergency situation. When do you need to go to the emergency clinic? and I'll be talking for about 20 to 30 minutes about this, and then answering as many questions as you like. This will be done with a video chat so that we'll actually be able to have a conversation in real time. So I'm really excited about that. So in the meantime, here are some quick guidelines for you. If your pet has vomited more than 3 times after you've pulled up the water, and that's key, if you've seen your pet vomit, pick up the food and the water immediately, because what tends to happen is they drink a ton of water, their stomach is still upset, and it comes right back up. And then if they vomit 2 or 3 more times, now they're dehydrated. So that's key. Pick the water up, wait 2 hours. If there's been no issues, offer a small amount of ice chips and some water. If everything is holding down, then gradually add a little bit more fluid so that they can rehydrate. Wait to feed for at least 12 hours. Now, if you've done all that and your pet is still vomiting, and it has vomited more than 3 times, to me, that's when you go to the emergency clinic. So the second situation, bloody diarrhea, or diarrhea that's occurring more than once an hour, that's when you need to go to the ER, because your pet's going to dehydrate very quickly. And aside from making them feel really cruddy, the other thing is that it's going to potentially create damage to the kidneys because of being dehydrated and then getting further dehydrated with fluid loss. Now, the other situation is if your pet is straining to urinate, but it's not producing urine. So for cats, this is life-threatening because they tend to get obstructed far more frequently than dogs. This is also a way that cats end up having kidney failure induced. But for dogs, we'll see them, if you're seeing your dog strain to urinate, more often than not, there are bladder stones present, although we can see some dogs become obstructed, meaning they cannot pass urine, period. And again, this becomes a life-threatening situation pretty quickly. And then the last sort of general situation is if your pet is really lethargic and has a high temperature and just feels cruddy and non-responsive, that's when you go. Now, at home, there's 2 ways to take a temperature, and sort of book normal for a dog and a cat is 101.5. And you can take the temperature rectally, and you can use the digital thermometers, that's perfectly fine. Use a little bit of corn oil or petroleum jelly, something like that, to lubricate. The other option, and this is not quite as accurate, but if your pet's having diarrhea or is sensitive about its rear end, this is much easier, is to literally stick the thermometer under the armpit and hold that closed. Now, this is going to register about 2 degrees low. So if normal is 101.5 from a rectal thermometer reading, then we're going to see 99.5 or thereabouts become the normal. So what that all means is that if you use the armpit method, and your pet's temperature is 101, that's too high, because that means it may actually be closer to 103, and that's a fever, pretty nasty one too. So great to see you all today. I'm gonna put the link in here for iPets Ally, and get that in there. The other thing I wanted to give you as well is a really cool article about anti-inflammatories. And let me put the link to the article in there first. This article looked at using anti-inflammatories for treating depression in people. And so they defined those as Celebrex, omega-3 fatty acids, and statins and minocyclines. And minocyclines are similar to doxycycline, which is, they're interesting antibiotics in the sense that they are used to treat a lot of different things.